I'd like to welcome everybody today. I'm here with Dr. John Paul Verderese from Inova Fairfax, and I'm Lisa Lancaster from Vanderbilt Lung Institute. And we're here to talk about high risk patients when they get COVID-19. So, what exactly do we mean by high risk patients? Well, those patients are the ones that are more likely to be hospitalized, more likely to need ICU care, require mechanical ventilation, and even die. Um, we certainly know that older age, more than 81% of COVID-19 deaths occurred in patients who are over the age of 65, which is just a huge number in percentage. But there are many other comorbidities and risk. John Paul, can you outline those for us?
Sure. Thanks, Lisa. So, yeah, certainly age, the sort of cutoff we use is greater than the age of 65, where, you're empirically considered to be high risk. But, virtually any other chronic medical condition, confers high risk. We'll go through some of those. There's a laundry list. It's probably good that you all familiarize yourself. There's some good resources on the CDC website, and it's an evolution. So some of these risk factors, might change a bit over time. So we know things like, active cancer, chronic kidney disease, certainly diabetes, any kind of chronic lung disease, in particular COPD. If you're immune compromised, if you have a neurologic condition, in particular a disability of sorts, if you have dementia, and then even things like having a smoking history or a recent smoking history confer risks. Other things, obesity or being overweight, and we kind of use the cutoff of a BMI greater than or equal to 30. Certainly, we've seen a lot of folks develop severe illness by virtue of their obesity. I want to highlight pregnancy alone. Most
Mm.
people consider themselves healthy as pregnant, but pregnancy confers risk, and anyone pregnant should consider themselves at high risk for developing complications. Some, I think, new things we've seen is there's some evidence have pointed out that folks that have certain mental health illnesses, such as depression or schizophrenic-like illnesses, those also confer high risk. Um, in the past, I think we've looked at things like hypertension and mild asthma. You may think that those confer a lot of risk. They do, but not as much as we thought. So I think that it's kind of an individual decision when you're speaking at your patients if they have isolated, well-controlled hypertension or maybe a history of asthma and are not using any controller medications at the time. So that sort of is what we consider high risk categories. And again, it's an evolution. The evidence is changing, and I recommend folks just keep themselves updated and look at the list every now and then, so they're ready to care for their patients when the time comes.
Yeah, I think that's very true. I think learning uh, COVID has taught us all one, patience and flexibility, because as healthcare providers and really as scientists, we take the best information that we have at the time and make plans. And as new data and information comes back, then plans evolve and change. And that's essentially what we do in medicine. That's what we do in science. There are supportive care ways that we can work to reduce the risk for patients with certain comorbidities. And they can be very simple and very master of the obvious too, like treating the comorbidities, staying up to date with all your good healthcare practices, exercise and weight loss and maintaining a healthy weight, getting the COVID vaccination and getting your boosters up to date, wearing a well-fitting mask if you're out in a crowd or a group of people, avoiding large crowds, washing your hands often, and just really checking in with yourself on your health. Um, have you used EvuShield much, and have you found that helpful in reducing risk?
Yeah, certainly. We've used it at our institution, probably one of the early adopters, and we've done a pretty extensive campaign to our patients within our health system and within the community in particular to their physicians, to let them know it's available and to get them the um, the prophylactic monoclonal antibody. In particular, we started with our transplant patients, and we've moved on to other folks our cancer patients, folks with rheumatologic illnesses that require immune therapy. So it's been successful. Um, and we are coming up on close to the 6 month mark when folks should be getting their second dose. So glad that we've had that therapy out there for folks, and we're convinced that it's definitely saved a lot of lives and a lot of hospitalizations.
Yeah, it's been amazing how rapidly in the short term medications and vaccinations have been found to be efficacious for patients. And gosh, it's great for us to have tools in our box to be able to use to prevent and to also to treat. So we really want patients to continue to stay in close touch and contact with their primary care physicians and with their specialty providers. Let them know if they're having symptoms so that your providers can guide you further on testing and what you can do to reduce your risk. And then ultimately, if you were to get COVID-19 infection, then how best to treat it for your particular risk comorbidities and ultimately follow up after illness.
I
Um,
can't agree more. I think patients need to know their risk, educated about what risk factors are, test immediately, have tests at home so they can call their doctor or practitioner and get therapy as soon as possible. We know that the quicker you get these therapies, the better chance they have of working.
I'd like to thank everybody for joining us, and hope you learned some pearls on uh, caring for your patients pre-COVID to reduce the risk. Thanks for joining.
Thank you.